Comprehensive Guide to Rotator Cuff Lesions. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Rotator cuff lesions refer to injuries or tears in the muscles and tendons of the rotator cuff in the shoulder. Clinical features include 1. Pain, typically felt at the front or side of the shoulder, which may worsen with specific movements. 2. Weakness, difficulty in lifting or rotating the arm, indicating a loss of strength. 3. Limited range of motion, reduced ability to move the shoulder through its full range. 4. Crepitus, a grating or crackling sound may be present during shoulder movement. Investigations for rotator cuff lesions may include 1. Imaging studies. X-rays can help identify bone abnormalities, while MRI or ultrasound is more effective in visualizing soft tissue injuries. 2. Physical examination. A thorough examination by a healthcare professional can reveal specific signs of rotator cuff dysfunction. Treatment options, aside from physiotherapy, may involve 1. Medications, non-steroidal anti-inflammatory drugs, NSAIDs, or pain relievers may be prescribed for pain management. 2. Corticosteroid injections. Injections into the shoulder joint can provide relief from inflammation and pain. 3. Activity modification. Avoiding activities that aggravate symptoms and modifying movement patterns. 4. Rest and ice. Resting the shoulder and applying ice can help reduce inflammation. In severe cases, especially with large tears, surgical intervention may be considered. It's important to consult with a healthcare professional for a proper diagnosis and appropriate treatment plan based on the specific characteristics of the rotator cuff lesion. Physiotherapy management. Day-wise and stage-wise physiotherapy management for rotator cuff lesions can vary based on the severity of the injury. Here's a general outline. Phase 1. Acute stage. Days 1 to 7 goals, pain relief and inflammation control. Physiotherapy interventions. Modalities like ice and ultrasound for pain management. Gentle pendulum exercises to maintain range of motion without stressing the injured cuff. Education on activity modification and avoiding aggravating movements. Phase 2. Subacute stage, weeks 2 to 6 goals, gradual restoration of range of motion and early strengthening. Physiotherapy interventions. Passive range of motion exercises to improve flexibility. Strengthening exercises for the surrounding muscles without causing excessive strain. Manual therapy techniques like joint mobilization if appropriate. Progression of pendulum exercises to active assisted range of motion. Phase 3, recovery and strengthening, weeks 6 to 12 goals, continued improvement in strength and functional abilities. Physiotherapy interventions. Progressive resistive exercises to strengthen the rotator cuff and surrounding muscles. Functional exercises mimicking daily activities to enhance shoulder stability. Gradual return to more complex movements. Home exercise program to maintain gains. Phase 4, return to activity, after week 12 goals, full restoration of function and return to normal activities. Physiotherapy interventions. sport or activity-specific exercises to ensure the shoulder is ready for the demands of particular activities. Addressing any residual deficits or imbalances. Emphasis on injury prevention strategies. It's important to note that the progression through these phases can vary based on individual factors and the specific nature of the rotator cuff lesion. Physiotherapy should be tailored to the patient's needs and closely supervised by a qualified professional. Always consult with a physiotherapist for personalized advice. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.